A very good evening to you and a warm welcome to our program iMed. And on iMed we make it a point to touch on various topics in terms of medical issues and concerns we have to really bother about. So today it would be for all those parents out there who are tuned in. It's about pediatric eye care, and we have with us a specialist who will explain us on various conditions we see in children, and sometimes it can go unnoticed and it can turn out to be very serious as well. So we have with us Dr. Niranjala Vidanage, and she is the Senior Registrar in Pediatric Ophthalmology, Lady Ridgeway Hospital for Children. A very good evening to you and welcome to our program, Doctor.
Very good evening and thank you.
Thank you for being here, and today we will be touching on various common and important concerns with regards to eye care for children. So let's talk about common and important eye problems we see among the newborn babies.
Yes, Sharifa. There are a lot of conditions among children. Some are most common and some are important, although not that much common. So I'll discuss about few topics today. First, I'll briefly discuss regarding eye discharge and tearing and redness, and the three symptoms may occur together or separately. Then regarding styes and squints, glaucoma and retinopathy of prematurity, the condition pathologic condition occurred only among the babies born prematurely. And then congenital cataract, that opacification of crystalline lens, and some cancers may grow inside the eyeball. And lastly, I will speak about eye complications occurred among babies with idiopathic juvenile arthritis.
So those are the main topics we will be focusing on, although there are various other concerns with regards to pediatric eye conditions or eye problems. So first and foremost, you mentioned about redness and eye discharge. We see this commonly even among the adults as well. So let's talk about the difference between that and what we see in babies and what should be done.
Yeah. Actually, this is the most common manifestation of the babies and the parents who are coming with babies to the outpatient department, even in government sector as well as private sector. So I can categorize the causes according to the age, because the causes are not similar in any age when we consider regarding the pediatrics eye. So we will move first into the among newborn babies. Newborn babies, the most common condition presenting with discharge and tearing is nasolacrimal duct obstruction. You may not hear about this earlier, so I'll explain a bit. Can you?
Yes, we can see the slide on screen as well.
Yeah, there's the nasolacrimal duct is a duct connecting your eye into your nasal canal. So through that, your excessive tears may drain from the eye into the nasal cavity.
Okay.
So usually during intrauterine life, it is not patent, but just after birth, usually it must be patent to drain the excessive tearing to the nasal cavity. But some children, the patent is not there just after birth. Usually it obstructed at the distal end, that means towards the nasal cavity. So that is the main cause for simple discharge and tearing, although the parents are very concerns about the infections, because we have to treat vigorously. But these mostly I can't say 100%, but usually the newborn babies come in with discharge due to this simple obstruction, and we are having very simple measure to manage this condition without going for surgery with early detection.
So early detection, in the sense what you generally see is eye discharge and also redness in the eye. Those are the symptoms, is it?
Usually tearing and discharge, not usually the redness is usually not there. Usually discharge and simple mucopurulent discharge and tearing.
Okay. So doctor, how can we manage this? Now you did mention that if this is detected early, it could be treated at home. So what should be done?
Yeah. Actually, just after coming towards the parents with the baby, we have to make sure that there is the NLD obstruction, because other things may be, other serious things may be there, even though this is the most common reason. So we are applying some, there's a picture they are demonstrating that fluorescent eye test.
Right, we can see it on screen now.
Yeah. We are applying some greenish color strain onto the inside the eye, over this face. Don't worry about the material, it is not irritating much. Then you can see in the left side it is remaining after about 2 to 3 minutes, but left eye you can't see anything. That means the left eye is right eye it is already drained. So that means left eye is having NLD obstruction. So that's how we simply confirm the diagnosis. After confirming diagnosis, we are reassuring the mother not to worry about this, not a serious infection, or not to be worried so much regarding the child. This pure and simple obstruction, nasal lacrimal obstruction, and start to do the massaging. So it's very important to do the proper technique of massaging, because the lot of parents are coming to me telling, doctor, I'm doing massaging for a long time, but still the discharge is persistent. So usually the thing is wrong technique. So it's very important to do the massaging correctly. So you have to use your index finger and keep the finger not on the bone. There's a bone there. As I must explain something regarding this duct system before going to the massaging. You may see that there's a 2 canaliculus is there, upper and lower. Then the lacrimal sac is there. Then it is going to the nasal cavity with the nasolacrimal duct. So this is the place we are touching. You can, I think,
yes,
you can see the
cursor.
Yeah, yes. This is the place we are applying the force by the index finger.
Right.
So you have to put your finger just beyond the nasal bone. There's a small dip there. You can feel that. You have to keep after cleaning your finger properly. Keep the finger here over that lacrimal sac and massage from upward to downward like this. 1, 2, 3 like this. 10 times each time, and at least 3 times per day. That means 30 times per day. You can do that even while the baby is feeding.
Doctor, if you don't mind, can we have the way you do it again?
Yeah.
If you could explain it.
Keep your index finger not on the bone. There's a small dip beyond the bone. I think you can see that.
You can feel it as well.
Yes,
right,
you can
doctor?
feel it.
It's
then
kind of not as hard as the bone.
No.
It's a bit softer, and
yes,
you feel it.
Yeah, you can feel small dip beyond the just posterior beyond the nasal bone. Then apply massaging from upward to downwards. Then you can see that. Then this due to this force, the secretion, the obstruction may be settled with the force, and the secretion may go drain to the nasal cavity.
So what happens in the long run, doctor? Now, how long does this procedure take? So how long do you have to keep massaging, and how do you see improvement in this?
Yeah, if the mother can see improvement with about 2 to 3 months, you can slowly stop the massaging, not at once, at 30 times per day, 20 times per day, like that. But if the secretion is going on even with massaging, we have to intervene after 1 year. Up to one year, we can manage this condition with massaging. After that, we have to intervene surgically. We are doing something called probing. So pathways maintained with the instruments.
So if this is not noticed, what happens?
You mean while massaging?
Yes.
Yeah. While massaging, what we are advised to mother is, if the patient is developing some swelling over this area, not around the eye, this area, that may be the lacrimal sac infection. We are called this mucocele. You can see the pictures as well.
Yes, we can have the slide on screen as well.
There's a small, you can see small bump is there. In that, this is the time we have to intervene urgent. We can't wait up to 1 year. We have to do the probing. So, once this the mucocele is appeared, the mother must quickly come to the eye surgeon.
So, do they misunderstand this for sore eyes as well? Is there any, have you come across any patients who thinks this is normal?
You mean the development of some swelling or eye discharge?
Eye discharge.
Usually they are very concerned about the children, so they are usually coming repeatedly. They are coming. They are complaining that I am doing massaging, still not settling.
Right.
So very rarely the parents are at home, and in these days especially.
Exactly. So shall we also touch upon the other conditions we see in newborns?
Yes. As I told you earlier, even though that is the most common condition, there may be a bit the other conditions are there may be big dangerous, and we have to treat vigorously. Just like neonatal conjunctivitis. This condition mainly common among babies who born through vaginal birth, is that normal birth, than the who delivered through cesarean section, because the baby is coming through the mother's birth canal. There are some germs are there, so they may contaminate with the eye. So in that case, we have to take some swab from the secretion, and we have to identify whether it is bacterial, viral or any other parasites, and we have to treat vigorously for the infection, because otherwise it will may spread beyond the inside the eyeball as well. That's why I told it's very important to differentiate this condition. You can't the mothers can't
identify
it.
So are these detected at birth itself, or do they have to specifically get an appointment with a pediatric ophthalmologist to further investigate in this?
You mean conjunctivitis?
Yes, conjunctivitis.
Yes, you have to come to the eye surgeon, and he will decide about further treatment.
Right. And doctor, can we also touch on allergic conjunctivitis as well?
Yes. As I discussed earlier, the NLD obstruction is the most common among newborn babies. Then we will discuss regarding the common condition among preschool children. Then we are coming to the topic of allergic conjunctivitis. Usually these preschool children come in with itchiness. They are always complaining, mother, I am always itching, rubbing. They are always rubbing and complaining the itchiness as well. As mentioned earlier, I can't say just come in with eye rubbing these allergic conjunctivitis. You have to examine properly. There are some features there to differentiate this condition from normal conjunctivitis. Allergic conjunctivitis are usually common among the babies with children with bronchial asthma, as well as babies with having past history of food allergies. So in that case, we have to examine the underneath of your upper eyelid to differentiate this condition, because as you see that
we will
picture, these are called giant papillae. These are a very severe stage of allergic conjunctivitis. So after once we identify this condition, we are prescribing the drug regime. Actually, not only one drug. We have to give mild steroids and histamine, lubrications to the because these lumps may rub over the eye surface, and we are giving some histamine analogues as well. Then the other thing I must highlight is as this allergic conjunctivitis, it has a recurrent nature. So some that means seasonal variation in some during some months of the year it may recur. So what the parents are doing, they know the drug regime we are prescribing. So they know the similar symptoms as well, because they know after this, for example, January, February, they are coming with this itching. So without coming to the doctor, they are
continuing the same
prescription as last. So avoid that, because there are two most important reasons why I am telling like that. First one is we are, as I told earlier, we are using steroids, so it has side effects. And this condition we have to use that some drugs long term, maybe some months. So in that case it had side effect of increased intraocular pressure. So we have to measure the pressure, and sometimes we have to tail off the drug regime, or if the conjunctivitis part is still severe, we have to continue the same regime, and we have to top up with the drugs with containing anti-glaucoma. That means reducing the intraocular pressure. That can't be done by parents. And the other thing is, as I showed in that picture, there are giant papillae are there. So they will rub or surface, and there may be development of ulcer over the cornea. So in that case it is very not like ulcer formation in your skin. If the ulcer is formed on your cornea, it is very difficult to heal. Very slowly, the healing process is very slow, and even though the complete healing is occurred later, the scar formation is there, with then may lead to reduction of vision. So don't use the same regime as the last episode of allergic conjunctivitis.
So each time you see similar symptoms, you still have to go and visit a doctor, and further.
And frequent follow-up is also there even after prescription of the drug regime.
Okay, so these are more prone to, as you mentioned, people who are allergic, kids who are allergic to certain food items, and also what are the other aggravating factors?
Yes, usually the pollens and house mites, house dust, and sometimes the pet fur for that from the cats and dogs. The fur may aggravate the condition. So the parents must be aware about this condition, and they asked not to hug the pets. They must advise the children to not to hug their pets frequently.
And also, doctor, is this the most common form of conjunctivitis among preschool children, or is there anything else which is common?
Again, conjunctivitis is coming after the allergic conjunctivitis in preschool children. Sometimes they may be due to the impacted foreign body over the cornea while they are playing. Like that, there are a lot, but I am discussing mainly the main causes. And the conjunctivitis is usually common among the school children. Because the cross contamination is there. It is highly contagious condition. So it is quickly, very quickly coming from one child to the other. Regarding this condition, it is coming with again redness, tearing and discharge. Usually the redness is bit more than the severe than the allergic conjunctivitis, and in this condition once we diagnose, we means that we have to come to the doctor and eye surgeon, and once we diagnose this as a conjunctivitis, we are prescribing you some antibiotics as well as some lubrications ointment. Then once you go home, you have to be careful how you look after the child about 1 to 2 weeks, because it is as I told you, it's very contagious. So keep away if there are several children at your home, you have to keep the baby separate and not sleeping at the same bed, on the same bed, and you have to remove the bed linens daily. And if the mother is must be with the baby, there must be the distance must be maintained even with the pillow. And we are advised not to share the towels, and put the always clean your hands before using the prescriptions.
And doctor, we've come towards the latter part of the program as well, final 10 minutes if I'm not mistaken. So you did mention at the beginning of the program that we will be touching upon styes as well.
Yeah.
So shall we also talk about styes, because we see this commonly among preschool children, even adults. So let's talk about preschool children in this case.
Yes. Styes, actually I'll start with my talk with the pathophysiology regarding the styes. There are glands over that upper and lower lids, and they are draining at the end of this upper eyelid towards the ocular surface. So because of obstruction of these glands, the styes are appeared. So usually just like allergic conjunctivitis, the symptoms may recur. So usually mothers are coming, the doctor again, the patient is developing same symptom. So, the styes usually come in with painful small bump near to the eyelid margin, maybe upper lid, maybe lower lid, or maybe sometimes both eyes. So, what we are advising in this stage is start hot fermentation early as possible. Hot fermentation means you have to get some clean cloth, cotton cloth, and some with the bit higher temperature. You have to soak it that and keep your just massaging over the gland, and it will the glandular structures that coming out from the gland will be dilated, and it may drain smoothly. Then the obstruction may be obscured. So, and with hot fermentation you have to use the antibiotic ointment as the drops, as well as sometimes we are given systemic antibiotics, oral antibiotics as well. So, sometimes the patient may feel the styes coming on with the small pain. So, what we are advising is in very early stage start hot fermentation, and sometimes if it is not cured with this regime, in that case we have to go to surgery. Very small surgery, it's an outpatient procedure. We are just putting a nick over the gland and allow the secretion to go out.
Right. Okay. So, what are the main causes of styes, doctor? Why do people end up getting this?
Yeah, actually, I can't say properly what are the reasons for that, because sometimes the poor hygiene. But I encountered a lot of children with even good hygiene. They are getting recurrent styes. Sometimes we are checking the blood sugar level to exclude diabetic mellitus, even in the baby is in younger age. But usually there's we can't say exactly what is the cause.
And doctor, we will be touching upon squint eyes as well, because that's also a very vital topic, isn't it? So let's briefly explain about it, because we've come towards the latter part of the program, but we do have another program which we will be elaborating this squint eyes in detail. So let's talk about what squint eyes is.
In brief, squint is a misalignment of your both eyes. That means one eye is focusing at your relevant image, but the other eyes may be going out or maybe going inward. We are calling exotrophy of the divergent squint, esotropy of the convergent squint. So, once the parents notice regarding a squint, you have to come to the eye surgeon early as possible, because sometimes people are thinking that some misbelief like that is calling that pink bupper, something like that. There's nothing called the good areas or good times of the baby to develop squints. So, always once you detect squints in any age, come to the doctor, and he will sometimes something called pseudo squint, but it must be diagnosed by the doctor, not by you. And sometimes some small kids, parents are complaining that doctor, some part of the day their squint is there, but later part of the day their squint is disappearing. So, it is also in this stage also you must bring the child, because it may be early part of development of squint. And what you can do is you can get your mobile phone and switch off on your flashlight and get a photo. Then you can see one eye is that flash is on at the middle of the cornea, and the other ties it outside of the cornea or inside of the cornea. So, that is simple test to detect at home if you are not sure. But you have if you are noticed the squint permanently, please come to the doctor early as possible. Then you can see in the picture this divergent squint and this inward convergent squint. So, after coming the child is, once we diagnose the patient is having squint, there are a lot of things to examine in the children, like we have to get the orthopedic assessment, that means the degree of the angle. Then we have to examine the inside the eye to see any other pathologies. For example, if the patient is having cancerous growth inside the eye, the first presentation may be squint. So, it is very important to get the patient early as possible. Then we are in the vision. If the vision is low and in that time, we have to get the vision back by occlusion therapy. I will discuss with you what is occlusion therapy.
I think we can actually discuss, we can discuss this on our next program in detail, because we have to wind up the show today.
Yeah.
And thank you so much for giving us a very good insight on different concerns with regards to pediatric eye problems. Thank you very much, Doctor.
Thank you.
And we will be back. We will continue with this topic on our next program. Thank you so much for tuning in. Have yourself a pleasant night.